Welcome back to OMFS Essentials. Today we begin a new topic that is the absolute foundation of our practice, aseptic technique. The word asepsis literally means a lack of sepsis. It is the comprehensive series of practices we undertake to prevent the entry of germs into a surgical wound. In this first of two episodes, we will focus on the physical environment, the planning, design, and preparation of the operating room. 1. The three-zone design. The first principle of aseptic design is isolation. The OR complex must be isolated from the rest of the hospital with its own separate air and water supplies to prevent cross-infection. This is achieved through a three-zone design to control the flow of personnel, patients, and air. A. Unrestricted, non-critical area. This is the lobby or outer barrier. Function, it's the transition from the outside world. It contains offices, changing rooms, and the pre-anesthetic room. Rule, street clothes and outside footwear are not permitted beyond this point. This is where the surgical team changes into scrub suits and OR footwear. B. Semi-restricted, semi-critical area. This is the prep or clean zone, acting as a barrier between the unrestricted and restricted areas. Function, it contains sterile storage rooms, endoscopy suites, and post-operative recovery. Rule, all personnel must be in their scrub suit, cap, and mask to enter this area. C. Restricted, critical area. This is the sterile core of the surgical suite. Function, this zone contains the operating rooms themselves and the scrub rooms, scrub sinks. Rule, full surgical attire, scrubs, cap, and mask is mandatory. Movement is minimized to prevent air disturbance. Patient flow. The patient is also part of this system. They are brought from the ward on an outside stretcher to the pre-anesthetic room where their hair and feet are covered. They are then transferred to a separate, inside stretcher that never leaves the OR complex. 2. Operating room design features. The OR itself is designed with one goal, to be easily and completely cleanable, leaving no place for dust or microbes to hide. Size. The room must be adequate for free movement, ideally not less than 500 square feet. Surfaces. All surfaces must be smooth, non-porous, and durable. Floors should be seamless, like epoxy resin, anti-skid, and anti-static. Walls, covered in smooth material like granite or stainless steel. Corners. Critically, all corners where walls meet the floor or each other should be molded and round, not sharp, to prevent dust accumulation. Utilities. All electrical fittings and water pipelines must be concealed within the walls. Air management. This is one of the most important factors. No ceiling fans. Fans are prohibited as they harbor dust and splash it into the surgical field. Air conditioning. The OR must be air conditioned to maintain a temperature around 20 degrees Celsius and relative humidity below 40%. High heat and humidity are tiring for the team and facilitate microbial growth. Airflow. The room must have a unidirectional, laminar airflow system with HPAC filters. This prevents multidirectional air currents from moving dust and microbes around the room. 3. Preparation of the operating room. Once the OR is built, it must be made and kept surgically clean. A. Fumigation. This is the process of sterilizing the room's air and surfaces. Method 1. An exothermic reaction using 40% formaldehyde and potassium permanganate, KMnO4, in a steel bowl. This is a fire hazard and must be kept away from flammable liquids. Method 2. A mechanical fumigator is used which boils a solution of formaldehyde and water. Procedure. The room is sealed airtight for 24 to 48 hours, allowing the fumes to kill all microorganisms. Verification. This is the most critical step. You must prove the fumigation worked. Procedure. After aeration, venting the fumes. Sterile swabs are taken from multiple sites: floor, walls, OR table, and trolleys. Culture. These swabs are sent to the microbiology lab for aerobic and anaerobic culture to detect any remaining organisms, especially Pseudomonas or Clostridium. Commissioning. The OR cannot be used until a negative report is received from the lab. Maintenance. Daily. Daily dusting and swabbing of all surfaces with an antiseptic solution like 2% carbolic acid or sodium hypochlorite. Weekly. A thorough washing and refumigation. Summary. Asepsis begins with the environment. The operating room is not just a room, but a controlled system designed to minimize contamination through zoning, unrestricted, semi-restricted, restricted, surface design, seamless, non-porous, rounded corners, atmospheric control, unidirectional air, low temperature, low humidity, verified sterilization, fumigation, and microbiological testing. In our next episode, we will cover the human element of aseptic technique, the preparation of the surgical team and the patient. You've been listening to OMFS Essentials. Subscribe for part 2, and as always, keep mastering the essentials.